comatose patient.
My name is Luke, and I was Zach's brother.
My name's Tyler, and I'm Mui's cousin.
My name's Chris, and I was Dr. Sanders.
My name's Gabby, and I was Mui's PT.
So you might be wondering, how does someone end up in a coma? A coma can result from a traumatic head injury, a stroke, a brain tumor, drug or alcohol intoxication, lack of oxygen to the brain, or even an underlying illness such as diabetes or an infection. The most common scenarios for someone to result in a coma would be after a car accident, a stroke, and a heart attack, a seizure, and toxicity or an overdose of drugs. Come in.
Hello. My name's Dr. Sanders. I'm working here at UPMC, Walnut. We got your test results back. Would you mind talking outside with me in the hallway real quick?
Yeah, of course.
After you.
Nope. Thank you, sir.
You're welcome. Now that I had you here in the hallway, it's a coma. You know, these things are very, very common. Nothing to be stressed about. It's very early for him. I think things will be okay.
Wait a minute. What's a coma?
So a coma is just a prolonged state of unconsciousness. As you can see, he's still unconscious. It is considered a medical emergency where immediate action must be taken in order to properly treat. And we have him in here early, so it's a good sign so far. But the problem is the longer a person is unconscious, the more likely they're to slip into a persistent vegetative state. But he's acting pretty normal now. Time will tell when it comes to that. And fortunately, it is not common for a coma to last more than a few weeks. So it's still pretty early. Like I said, only time will tell with stuff, these kind of things.
Oh my goodness, that sounds pretty serious.
It is very serious. And we have him in here though. We have very good care here. We'll take care of him. The reason why we know it is a coma is because he has closed eyes. He has a very depressed brainstem reflexes like pupil light reflex. He has no limb response other than a reflex movement. No pain response other than a reflex movement. We did a bunch of tests on him. He's only just basically when a reflex happens, there's no higher brain brain activity. It just goes to the brainstem back. So like a quick knee jerk, like when you're growing up in the hospital, they did it on your knee. So that's what a reflex is. And he's had irregular breathing. We have had to be careful in monitoring that.
Oh my goodness. So how my brother got in a coma was he just got his motorcycle license, and he was going on one of his very first rides, and I was following behind him in a car when all of a sudden he slid on some loose gravel and kind of wiped out in the middle of the intersection. I was very nervous at first because he didn't move at all, and I knew something bad was happening because he also wasn't wearing his helmet. And so I immediately called 911, and they told me not to worry, that everything was going to be okay. And when I got back to the hospital, Dr. Sanders talked to me and told me that he's suffering from a coma.
Gathered you guys in here today to talk about a coma. I know Mui's very near dear to you guys' hearts, and I really want to make sure that he's going to be okay. He's going to be okay.
So what are some possible causes of a coma?
Well, there are many types of problems that can cause a coma. You know, there's a lot of examples. You know, traumatic brain injuries, stroke, tumors, diabetes, lack of oxygen, infections, seizures, toxins, even drugs and alcohol can cause a coma.
So then who is most commonly affected?
Well, many people are affected by a coma, although there are three main categories. First one's intracranial. Events occurring within the skull. For example, people who get an infection, severe head injury, stroke, brain abscess, brain tumor, cerebral edema, or the after effects of an epileptic seizure. There's also extracranial, where external event that reduces oxygen or blood flow to the brain. Examples for these include people get a heart attack, alcohol poisoning, drug overdose, carbon monoxide poisoning, liver or kidney failure, hypoglycemia, hyperglycemia, fever, electrocution, and hypothermia. And the last one would be psychiatric, mental disorder, basically for people with depression and catatonia. For your friend Mui's case, this is intracranial. The other two just don't fit the bill on this one.
So what are the outcomes?
Well, many people can recover from a coma. However, others enter a vegetative state or death. Some people who recover from a coma can have a major or minor disabilities. Complications that can develop during a coma include pressure sores, bladder infections, and blood clots. With Muey, I think he'll recover. There might be some minor disabilities. I think it might take him some time to learn to walk again. There could be some type of paralysis of the lower body. We don't know. We still have to find the results, get the test, but he's going to be in a lot of physical therapy after this. But I do believe, I've seen this injury before, I think he will recover.
It's good to hear.
You're doing you. Don't worry.
Hey guys, how are we doing?
Good, how are you, Doc?
Not bad.
I'm good. Is he doing all right?
I think so.
EKG's reading normally, so he's got a nice heart rate going still.
So, I was just wondering, what are some treatment options that we can do?
I figured you might ask. Treatments are varying depending on the cause of the coma. If the coma was a result of a drug overdose, which it wasn't, we'll give medications to treat the condition. If it was due to a seizure, which I don't think he has a previous history of seizures, does he? We will then administer medications to control the seizure. But other treatments may focus on medications or therapies to address an underlying disease such as diabetes or liver disease. Sometimes the cause of the coma can be completely reversed and the affected person will regain normal function. But if the affected person has suffered severe brain damage, he or she may sustain permanent disabilities or may never regain consciousness. The person may enter a persistent vegetative state or become brain dead. So with your friend Muey, it's once he wakes up, that's all we can do. The only thing we could give him is physical therapy, learning to do daily activities of living, and maybe some medications that might help, but it's just his body from there on to see what happens and how it reacts. Since it's very early, the prognosis is difficult to determine because each one is different and there are too many variables, and also depends on the cause of the coma. The patient can end up waking up from the coma and be able to regain all of their abilities, like I said, but depends on what happens once he wakes up and how long he stays sleeping, or unconscious, I should say. Also, the patient can take a turn for the worst, not wake up and become brain dead while they're still living off of machines. In that case, we'd have to pull the plug.
Oh my god.
Guys.
Muey!
Brother!
What happened?
Dr. Sanders!
Doctor!
Doctor!
Motorcycle.
Oh my god!
He's
Is he awake?
Yes!
Great Scott.
Hi, Muey. How are you?
Doing okay.
You're
How are you
pretty fine.
feeling?
Well, having trouble moving my legs.
Hopefully, we can get that fixed for you.
I'll take those for you, buddy.
Thank you.
He's all yours, Doc.
Alrighty. How long has it been since you've been out of the coma?
It's only been a few weeks, but I feel better.
Gotcha. Well, I think with some due time and some more physical therapy, you'll recover in no time. There hasn't been any serious brain damage, and it depends on the severity of the course, but I think that you won't have any serious consequences. Let's see your how we can do these flexes and stuff like that. Does that hurt?
No, that feels okay.
Alright, that's a good sign.
Yeah. Woo. Woo.